Good morning. It's Amanda Hansen here at the Action News 5 digital desk, and we have been talking all month long. It has been it's Donate Life Month, and this week specifically is Pediatric Transplant Week, and so we want to talk more about it, the need here in the Mid-South. And joining us now to talk more about it, we have Tiffany Street. She is a nurse and also heart transplant coordinator with the Heart Failure and Transplant team over at Bonheur, alongside Dr. Hugo Martinez, who is the Advanced Cardiac Therapies and Transplant Cardiologist Director for the Heart Institute at Bonheur Children's Hospital. Both of you, good morning. How are you doing?
Good morning.
Good morning. Thanks for hosting.
Absolutely. I'm glad to have y'all on here because my dad at one point was on the transplant list. So this is something that's really near and dear to me to be able to get the word out. I know I'm an organ donor. I have it on my license. And so I guess let's start out by just talking about the need when it comes to children specifically. I know y'all focus on heart transplants. Tiffany, can you talk a little bit about the need here in the Mid-South?
Absolutely. So here at Bonheur, our pediatric heart transplant program evaluates referrals for children who have end-stage heart failure or congenital heart disease. And the patients that we serve typically aren't just from Memphis, but also Arkansas, North Mississippi, even the southern ends of Missouri, all of western Tennessee. So those patients get referred to us from the region. As well as we have an abdominal, kidney, liver program as well. So we're supporting a large area, not just Shelby County.
Absolutely. And how big is that? Is there a number to put on there as far as like how many children are maybe waiting for this life-saving organ?
Absolutely. So if all pediatrics in the United States, there's about 2,029 children from ages infants all the way to 17 waiting on all organs. Specifically for heart, you're looking at about 483 in the United States. We've had 32 candidates waitlisted since 2020. So, and we've performed about 28 transplants just in the last 3 years, just for our local community.
Oh, wow. Dr. Martinez, I want to talk with you a little bit about your role in all this. Obviously, you're working with a lot of families. Can you talk to me about what that's like, some of the stories that maybe you can share a little bit about?
Absolutely. So we have a center that specializes in advanced cardiac therapies, whether the patients are born with certain diseases that will require transplantation or patients who later in different ages and stages will require advanced cardiac therapies. And for some people, transplantation is the only pathway moving forward. So we're here to deliver the message of generating education and awareness that we require long times waiting for organs. So we would appreciate if our community sign up for organ donation, because that will promote life moving forward, as I mentioned, for many families.
Well, Dr. Martinez, I know you're mentioning wait times. How long is that normally when you talk about something like this when it comes to pediatric patients needing a heart?
It varies by age, but patients within the very first 3 years of life, the wait time can go somewhere around a few to a couple to a few months. So on average, we can say 6 to 8 months. And that is talking about the scarcity of organs because we don't have it on the shelf.
Yeah, we had a situation when I worked in Jonesboro, Arkansas. There was a young man that needed a heart transplant, and he actually had a backpack that helped pump his heart for him. And he had to wait a long time to be able to get that transplant, that life-saving transplant that really changed his life. I want to talk with you, Tiffany. Obviously, this is something that is near and dear to you. Talk to me about what it's like for you to be able to be a part of this and helping to facilitate this process.
It's really an honor to be a part of our patients' recipients' journey from the beginning referral to, hearing their child has a diagnosis, whether that be an infant first grader, a teenager. So we become very involved with the family. We become very close, emotional support. Just it's an honor to walk with them in that journey. It's beyond words when someone's donated that gift, and to see these children thrive post-op, and the feedback that's given, that's back to the organ procurement organization, which is Mid-South Transplant for our community. They communicate back to the donor family the outcome, and the feedback is phenomenal about how moving that is, and how it helps them feel honored and grieve with the loss of their loved one. So it's just therapeutic on both sides, and it's an honor and beautiful to be a part of all of it. So it's great.
I can imagine. Dr. Martinez, I know you were mentioning as far as numbers and wait times and that sort of thing, it varies based on age. Are there any challenges when it comes to just different age, say whether it's a toddler or a teen? Can you talk about that a little bit?
Absolutely. Challenges come in both sides, and those patients and families waiting for organ donation, and those patients and families helping us to donate. And when it comes to organ donation in the pediatric population, size matters. We have to be very careful about accepting organs that are not too big, because they're not going to fit in somebody's chest. And we have to be very careful about accepting an organ that is not going to be too small, because it's not going to supply the adequate demands for a given patient. So wait times can be lengthy, and that is because we really are focusing on waiting for the right time, for the right moment, and for the right organ donation.
And as we mentioned, it's Pediatric Transplant Week. I want to speak and talk to each of you about what message you really want to leave people with. Dr. Martinez, would you like to start things off?
Absolutely. I think this week is an opportunity for us to promote education, an opportunity for us to, generate awareness. There is no limit to become an organ donor. So I would like to deliver the message to families to talk among themselves and amongst family members to say, if we would like to donate, there's really no limits. So minors can donate, and make sure your wishes are known about this situation.
Tiffany, what would you like to add to that?
I was going to say the same thing. I think just having that roundtable conversation at dinner with your parents, however old they may be, with your children, if you're an adult, just to have those conversations. If you're very passionate about it, you can also sign up when you go and get your driver's license at the county clerk's office, when you register to vote or get your new tags. You can go online, you can have the app. So there's plenty of ways to register, but it's, I think, too important to have those conversations with your loved ones.
Well, I appreciate both of y'all taking time this morning to share the message, get it out there about the need here in our area and surrounding areas. Y'all have a great rest of your morning, all right?
Thank you.
Thank you. You do the same.